Hello, and welcome to the training demonstration of how to effectively navigate the clinical portal. My name is Sharon Barra, and I'm the Clinical Program Coordinator here at HeatlhInfoNet. We're going to start the demonstration on what we call the splash screen. This is where you will enter the clinical portal by using your user ID and then your unique password. Before we get started, though, I'd like to make sure that you're aware that this is a test environment and no patient identifiable information is available. One of the places that you can check to see information that's in the portal is by going to this link. Click here to see data captured in HeatlhInfoNet. By clicking on that, you're going to come to a spreadsheet. Now, I'm going to make that just a little bit bigger for you to be able to see clearly. This is a spreadsheet that has all of the organizations here to the left that are connected to HeatlhInfoNet. And on the very top is all the information that is able to be sent to HeatlhInfoNet. And if the box next to the name of the organization has a check in it, that means that they are sending us that particular data. This is very helpful when you're looking for particular documents or information, because not all organizations throughout the state are sending us exactly the same data. One thing to be aware of is this update information right here, because it's updated regularly. If someone's not sending some data today, well, they might be doing it tomorrow. We're constantly working on that, and that's really important to have that updated information. And you can print this off by right-hand clicking and using your print button there. So let's go back to HeatlhInfoNet splash screen, and I'm going to use my ID here and then my password and enter the clinical portal. The first thing that you're going to come to is the search criteria page, and that's how you're going to find your patient. And I'm going to put my first patient name here, who is Minnie Mouse. Using first and last name is one of the easiest way to find your patient. If you have the date of birth right here, please use it, and it can even sort out even more patients. So the next thing is over here is your search button. Once you pull up the search button, you're going to get the Minnie Mouses throughout the state of Maine. And you need to make sure that you identify the patient that you need by the date of birth if you do not use the date of birth sorting. If you're not putting in the date of birth here, then make sure you do get the correct date of birth here to get into the right patient's record. So before we get started, there's a few things I want to show you on this particular page of the portal. There's the opt-out date and the mental health consent. If there's a date in this column next to a patient's name, that means that they have decided to opt out of the clinical portal, and there will be no data available for you to view. We do keep their name and demographics to make sure that information has been deleted, and if they do decide to opt back in. The second column for mental health consent, if you see a date in that column next to your patient's name, that means the patient has opted in to have their behavioral health information provided by a behavioral health provider. It's readily available in the portal globally for you to see. If there is no date here, that means that information is shielded, and you are able to get into it under two different circumstances, and I will share that with you later. The other thing I want to show you quickly before we move on is our lock-in key, which is here to the left. This is one of our security measures that you need to identify who you are and why you're in the chart as part of our security confidentiality process. If the lock-in key is closed, that means I have to break the glass, and I'm going to show that to you. Once you break the glass on a particular patient, it's available for you to view that patient's data for 3 days, and then it will close again. So let's use this first Minnie Mouse right here. So this is what we call the breaking of the glass. So a reason is required to view the information. With this drop down, you get to choose the organization or as close as you can to the type of direct patient care you're doing, such as a consultant, ambulatory care, hospital, mental health, a pharmacy. Care coordination and quality data support are all under direct patient care and do not need to have a typed in reason why you're in the chart. And you can just quickly go to the portal as needed. However, if you're information technology support, there will be a required word here, which means you need to put something in the comment or it will not allow you to enter. I will demonstrate now, though, if you are in ambulatory care, you can just click on OK. Comment is not required, and it'll open up the clinical portal. So as the data is flowing in to Minnie Mouse's clinical portal, I'm going to just show you that the three major parts of the clinical portal that you're going to be seeing. Over here to the left, this is called the menu. This is called the clinical document tree because it'll have folders with documents. And this is what we call the clinical summary. And this is where you'll have all the data and information on the patient. The reason I wanted to show you Minnie Mouse at this time is I want to break the glass to show you how you will look at sensitive data. As I stated before, if this person has not globally opted in to have their behavioral health readily available, and if they did, though, it would be under here in the summary documents, you are allowed to look at that information under two different circumstances. The first one would be an emergent situation, or if the patient is seeing you and gives you permission one-on-one to look at the data at this time. If that's the case, then you're going to go on the clinical document tree, and you're going to go up here to the very top where it says certain sensitive patient information is not displayed due to legal restrictions. There may be protected mental health data. Well, you know that there is. The patient's given you permission to look at it. So you're going to click on the More button, and you're going to get your secondary breaking of the glass to open up and have the behavioral health information flow into the clinical portal. After reading this information stating that you have decided that this is either an emergency or the patient has given you permission, this is already defaulted to be checked off. Give again a reason why you're in the chart. This is I'm an ambulatory care nurse. And then you are responding to a medical emergency, or the patient legal representative has consented to my access described above by access, and that my access will be recorded and may be audited. By okaying that, it breaks the glass, as you can see here, to bring in sensitive data. And once you open that up, the documents will be there available for you in the document tree, but also in the clinical portal where it says sensitive data is displayed. So we're completed our work with Minnie Mouse, and we want to go to another patient. To make that work for you, there's a couple ways that you can do that. You can do another demographic search by putting in the first and last name, or you can go here in the menu to do recent patients, and that'll keep track of all of your patients you have seen. And you can control that by clicking a few of these that you don't need anymore and removing them. But this will have a list of all of your recent patients.